to the Dr. Ardis Show. I'm your host, Dr. Brian Ardis. Let's get through some sponsors. The NorthTexasHealingCenter.com. Go there or call them at 214-705-9369. If you are sick of being sick, or if you're tired of being tired, call them today or go to their website, set up an appointment. They help you identify the underlying causes for symptoms and diseases, like some of the ones we're going to talk about tonight. Second sponsor is MyPillow. Go there and buy something. Buy some slippers for a present, for a gift. You know, it's almost Valentine's Day. Go buy something there. Buy some towels, which is my favorite thing there at their site. Anyway, need pillows, towels, you name it. Go to mypillow.com. Use the promo code DOCTOR. It'll populate even more savings for you. Thanks, Mike Lindell, for supporting the Dr. Ardis Show. Third sponsor is brighteonstore.com. That's Mike Adams' platform. Go to brighteonstore.com. They've got everything MyPillow doesn't. Type in doctor at promo code at checkout. We're making it easy for you. Doctor at either one of them. Saves you 5% off anything you buy there. Thank you for the support from all of these people. Thank you very much. All right, tonight we're going to destroy the narrative around cholesterol. This is our second live Tuesday night, 7:30 to 8:30 Central Time. This is our third one. Yep. All right, so the first one was on destroying the thyroid narrative. Go back and watch that at vocalnow.com. For the 5 or 6 people streaming right now, you guys are fabulous. We're doubling our actual attendance every week. It's phenomenal. Isn't it, Christina?
It's wonderful.
Yeah,
and we're also on Rumble.
So excited.
Subscribe to us on Rumble, The Dr. Ardis Show.
That's our producer, Christina. She's rocking it. All right, so we're glad we're here. First week was actually thyroid. We destroyed that narrative around thyroid disease. Secondly was last week. It was me and 40-year board-certified cardiologist, Dr. Thomas E. Levy, going through blood clot disorders. That was very pertinent to the discussion right now surrounding COVID and vaccines. That's why we did it all last week. And then this week, we're going to talk about cholesterol. Why? Because it's one of the greatest lies I haven't addressed yet. So it's one of my favorite things to address with patients over the last 20 years because every single one of you have been lied to about cholesterol. Everyone in America thinks it's bad for you, and some man told you that, and it's not true. All right, so we're going to do that. We're going to destroy that narrative. All right, so let's just dive into it. We're going to go through here. If you have any questions, submit them. We're ready to answer them. We'll wrap those up at the end of this presentation, but you're going to learn a lot from me. If you want to know just right off the bat, there's a book. If you would like to know if everything I'm talking about and showing you tonight, if it's really true or not, please go buy a book. It's called The Cholesterol Hoax, Hoax. It was written by a medical doctor named Sherry Rogers. She actually takes you through the whole history of why it is the pharmaceutical companies even invented the idea of testing for cholesterol, and then why they decided to call it something damaging, increasing risk of heart attacks and strokes, and then why it is they use statin drugs to convince you needed to lower it to prevent heart attacks and strokes, which in reality it doesn't do if you lower cholesterol. All right, so we're going to go through that. So what is cholesterol? Let's go through these slides. We'll put them up for you. And I'm going to give credit where it's due. Christina, our producer, helped put together all these slides. I fed her some info, but the majority of this is her doing. She knows what I want. She's on the screen. Everybody say hi. Wave at her. There you go.
Guys.
There you go. All right, here we go. All right, so what is cholesterol? All right, so cholesterol is something the majority of is made in your liver from the fats you consume, but cholesterol has tons of things that it does for us, right? You've got different versions. You got LDL, which they call bad cholesterol, which is not bad. Some people just called it that because they figured out a drug could reduce it, so they had to make it bad because they can manipulate it with their drug. You got LDLs, you got HDLs, which are supposedly the good cholesterol, and then what's called triglycerides. But these lipids, or fats that are converted into cholesterol, are used almost to make the majority of hormones you even have in your body. So your emotions, your sex drive, your energy, your hormone balance, your periods, you name it, are all actually produced, managed, governed by the cholesterol you make, which is later in the body converted into hormones. All right, so cholesterol is found in your bloodstream, and every cell in your body has to have it. It helps produce cell membranes, vitamin D, bile acids, which bile comes from your gallbladder to help you break down fats, enhances neurological function. In fact, your brain needs cholesterol in order to even fire nerves with things like choline and serotonin. You got to have cholesterol for that. You'll see that third bullet point there. It actually says drastically lowering cholesterol actually increases your risk of dying. We're going to talk about that here in a little bit. Your liver makes up 75% of everything. We already mentioned that. In the United States, you're all lied to and told that cholesterol is bad for you. It is not. All right. Well, I mentioned HDLs, LDLs, triglycerides. We'll take you through what those are. LDL is what they call the bad cholesterol. Look at number 2. This is actually warned. I just want you to know. I used to tell people in my clinic all the time, if you want to know what LDLs are and why they're important, you ever picked off a scab when you had a wound? You know, you can peel it off. That's LDL cholesterol. Your cholesterol, the LDL cholesterol, was used to keep you from bleeding to death. It's a part of the clotting factor to keep you from internally bleeding to death or externally. You need it. All right, so it's important. Let's go to high density lipoprotein, HDLs. That's what's called the good cholesterol. Supposedly helps keep your arteries healthy, blood thin and healthy. All right, then you got your triglycerides. These are fats that have been linked to diabetes and heart disease, supposedly. They're known to go up. Just so you know, if you have high triglycerides, the very first thing I always told people was, you've got lots of starches and pastas you're eating. I mean, that's really the number one thing. You can actually slash triglycerides like 80%, 90% just by removing starches for 5 to 6 days. Tons of people do it. It's phenomenal. Just get the grains, the breads, the bagels, the pastries out of your diet. You'll see that just crash. It's amazing. You can actually mess with your medical doctors and their blood work before they take your blood test. Just don't eat any grains for the 5 days before you do the test, and your triglycerides will be miraculous. Even for your insurance test, right? When they want to check your cholesterol to determine your premiums for your insurance company, just make sure for the 5 days before you do that test, if you have cholesterol issues you think, just avoid all the breads and grains. It's going to be greatly reduced, and you're going to look fabulous. Okay. Also, drinking alcohol excessively, as you see there. Cigarettes also. All right, so you're not actually told by your medical doctors very often that you need to actually address your diet and fix it. No, what you're sold is the idea that there's a drug for you if LDL cholesterols, triglycerides are out of the roof and beyond normal. I just want you to know, it used to be back in like the 80s that a high or normal reference for cholesterol was like a 300. Then they moved it down to 250. Then they moved it down to 200. So they keep lowering normal so they can sell you more drugs, just so you know. But statin drugs, as you see on the screen, 35 million prescriptions, or 35 million people are taking them around the country, which is insane. All right. They tell you that these statin drugs, the most common named statin drug is called Lipitor. Since 1997, Lipitor is the number one most sold and prescribed drug in America, period. They haven't sold another drug more than that one, Lipitor. So they got a whole bunch of Americans convinced, obviously, that they need to take their drug to reduce their cholesterol. You know what's amazing? Since 1997, do you know what still the number one and number two causes of death in America are, Christina? Cancer and heart disease. Yet they've told you you got to lower your cholesterol levels with these statin drugs since 1997. And if you do it, we're going to reduce heart attacks and strokes in this country. No, they've still gone up. They've still been the second or first. They interchange cancer and heart disease. Still the number one cause or number two cause of death in America is heart disease. And the majority of you adults are on these drugs, supposedly to protect you from that. We're going to get into some of these drugs later because they're not really the solution. All right, so the next slide here. This is a great slide. It actually has a list of the published side effects to statin drugs, which there are 5 most common statin drugs. If you look at the generic name, atorvastatin is Lipitor, but on the generic names for each of the drugs, you will see statin is the end of the drug's name. That means it's a cholesterol-lowering drug. Anyway, when you see the statins, when I say statin, that's the generic name of these drugs. Atorvastatin is Lipitor, and these are some of the known side effects. I want to bring your attention to the very first one on this graphic. The number one thing that people come to chiropractic offices for is musculoskeletal pain, meaning their back hurts, their hips hurt, their legs hurt, their arms hurt, their elbows, their knees. I have to tell you, 80% of the people that I could get rid of their pain in 2 weeks or less without even adjusting them, all of them were on a statin drug. And the statin drug was causing the pain. That is the number one published most common side effect to all statin drugs, is it creates pain in your body. It could be back pain. It could be shoulder pain, hip pain, you name it, knee pain. And the moment I would see on their chart day one If they complained of a pain somewhere in their body, I would then look at their medication list and I would ask them, how long have you had your pain? They'd say 3 or 4 years or 10 years, whatever it was. And I'd go, great. When did you start this statin drug? It always was 6 months to a year before their body pain started. And then I would look at them and I would say, it's the drug, by the way. You just need to stop that statin drug. And by the way, I will speak from experience here. Go ask any of your medical doctors if you want to. There are no side effects to coming off of cholesterol drugs immediately. That is not the same for like high blood pressure drugs or for antipsychotic drugs. You got to wean off of those over time. And you should be having someone help you heal so you don't have those issues and can come off those drugs later. That is not the case with cholesterol drugs. You can stop those immediately, and then your pain will start subsiding within 48 hours or 72 hours. It's miraculous. All right, so first one on there, muscle pain. Second, headaches. How many of you are living with headaches? And how many loved ones do you have that are on cholesterol drugs? Fatigue is the fourth one. Difficulty sleeping, of course, that goes with fatigue. Two things that were the primary complaints in my office. If they dealt with pain primarily, that would have been one very common one. Outside of that, it was always, I can't control my weight or my appetite, and I'm so tired all the time. So weight concerns and fatigue. Well, cholesterol drugs destroy your metabolism. They destroy your appetite, and they impact your energy. Why? You can't even make adrenaline. You don't have enough cholesterol to produce enough hormones. You don't have enough serotonin, which is what's used. You have to use cholesterol to make it. That's your happy, feel-good hormone. So a lot of people experience depression. All right, you'll see memory loss and confusion. Why you need cholesterol to help with the brain's function. And these side effects of the drugs impact memory and cognitive function. You'll see infertility also. Why? It impacts your hormones. That's what it does. Increased risk of heart failure. Look at that at the bottom. Why'd your cardiologist or MD put you on it in the first place? They said it was going to protect you from heart disease. It is a known side effect that it can lead to and increase your risks for heart attacks and strokes. Isn't that an oxymoron? They're selling you that idea that that's what you need it for. Also, the increased risk of type 2 diabetes. All right. I'm just going to put it right here. Statin drugs are not the major cause for type 2 diabetes. That is not true. Even though it's inside of our discussion tonight, it can do that. That is not the number one cause. The number one cause are sodas, pizzas, potato chips, cereals, you name it. That's what does it. All right. Let's look at some of the roles that cholesterol plays, because I know a lot of people in the audience don't know what it does, besides the fact I just said it helps you produce scabs so you don't bleed to death. All right, so here's some of the major roles. You need it to make all the cell membranes in your body. It makes them waterproof so that different things can move in and out of what they call the cell membrane wall, which is that bilipid layer that all your cells have inside of it, the nucleus. There are organelles, these little bitty organs inside the cells, like mitochondria that make energy and other things. Cholesterol's nature's repair substance, like I already mentioned here. It also helps you to make tears and helps repair arteries, which is not what you're told. You're told it actually clogs up arteries, which you learned about last week, by the way. If you go back and watch me and Dr. Thomas E. Levy's interview, we talk about what happens to arteries to cause blood clotting disorders. We teach you all about it there. And then we mentioned earlier that many hormones are actually used by, you have to use cholesterol to make those hormones. You see here at the fourth bullet point, sex hormones, testosterone, estrogen, progesterone. You need it. You also need cholesterol to be able to help manage blood sugar appropriately, which is why that type 2 diabetes was on the previous graphic. All right, here's some other roles. I mentioned it's good for helping raise serotonin levels, which helps combat depression, which is that second bullet point there on the screen. And we have to have cholesterol. We have to have fats. I mean, 70% of your entire brain is made up of fat. That's why you can take the brain out of somebody's body and it'll actually float on water. Fats actually are less dense than water, so it floats on top. So you need fats. Bile salts made in the gallbladder. You actually need it. You need cholesterol to help you make that stuff so you can digest your foods. It's the precursor to vitamin D. Imagine that. Cholesterol is a powerful antioxidant, which is phenomenal, like we mentioned in previous episodes with vitamin C, magnesium, selenium. These are all antioxidants. So is cholesterol. And you'll notice that we will go over this in a minute. That last bullet point on there, it says cholesterol, especially LDL cholesterol, helps to fight and combat infections. This is very specific, by the way. It actually helps you combat viral infections. And one of the number one most common symptoms and side effects for Lipitor and Pervistatin, which is the second most common prescribed drug for cholesterol in America. The number one side effect that affects 10% of all Lipitor patients and all 14% of all Pervistatin patients is what they call nasopharyngitis, which is actually a medical term for the common cold. So if you start reducing cholesterol, you start to get viral infections and symptoms as a result. Number one side effect, these people will stay ill with chronic reoccurring colds and influenza and pneumonias when they start their cholesterol drugs. Cannot tell you how many upper respiratory chronic infection patients I saw, and the cholesterol drugs they were doing were causing tons of it as it's published and known side effect. All right, let's look at myths and truths around cholesterol. Let's put up the next slide. Myth: people with high cholesterol are more prone to heart attacks. Truth: young and middle-aged men with cholesterol levels over 350, which if somebody looks at your blood work and says you got 350, they're going to say we need to get down to 200. They are slightly more at risk for heart attacks. Those who have cholesterol levels just below 350 are at no greater risk than those whose cholesterol is very low. For elderly men and for women of all ages, high cholesterol is associated with a longer lifespan. Did you hear that or read that? High cholesterol in elderly men and women of all ages. High cholesterol is associated with a longer lifespan. But that's not what you're sold. That's not what you're told. All right, let's look at the next myth. Cholesterol and saturated fat clog your arteries. I can tell you one thing that's clogging arteries right now around the world. These mRNA vaccines, per the Circulation Journal from the American Heart Association. They said the mRNA vaccines increase dramatically thrombotic events, which is blood clotting. All right. Myth: cholesterol and saturated fats clog arteries. Truth: there's very little cholesterol or saturated fat in your artery plaque or clogs. Most of the material is a calcium deposit that's very similar to lime, and most of the fatty acids are unsaturated. All right, next myth: eating saturated fat and cholesterol-rich foods will cause cholesterol levels to rise and make more people susceptible to heart disease. Well, the truth is, many studies show that there's no relationship between diet and cholesterol levels. 85% of your entire cholesterol level, I'm speaking off of this screen right here, 85% of all of your cholesterol levels are determined by your genetics and have nothing to do with what you eat. That's why you shouldn't manipulate your cholesterol, because 85% of it, regardless of what you eat, is actually all made up of just your genetics ability to produce cholesterol from your liver. All right, so there's no evidence that saturated fat and cholesterol-rich foods contribute to heart disease. As Americans have cut back on saturated fat and cholesterol-rich foods, rates of heart disease has gone up, which is what we just talked about. They've just continued to climb. More myths. Cholesterol-lowering drugs have saved many lives. Kind of like what Donald Trump said about his millions of lives have been saved with his vaccine. Very similar to that statement, which is a flat-out lie. All right, cholesterol-lowering drugs have saved many lives. No. Truth: in the two most recent trials involving 10,000 subjects, cholesterol lowering did not result in an improvement in outcome. Very interesting. No, next myth around cholesterol. Countries that have a high consumption of animal fat and cholesterol have higher rates of heart disease. Well, there's many exceptions to this observation, such as France and Spain. Furthermore, an association called a risk factor is not the same as a cause. In wealthy countries where people eat a lot of animal foods, many other factors exist that contribute to heart disease, actually. So, let's put up the next slide, because everybody that goes on cholesterol drugs has been lied to that they need cholesterol drugs in order to keep them from developing heart disease, strokes, and blood-clogging arteries that are going to lead to strokes and embolisms and heart attacks. So, what's the truth about avoiding heart disease if it's not really statin drugs? Stop worrying about your cholesterol. I've said it for years in practice. Everyone needs to forget about your cholesterol. If there's one thing you can do, ignore that one. Remember, I just told you 85% regardless of whatever you eat or drink or put in your body. 85% of your entire cholesterol level is made up from your genetics. Your body just makes it. So stop worrying about it. Number 2, do not take cholesterol-lowering drugs. They contribute to heart failure, and that is absolutely true. Avoid processed food, especially processed vegetable oils and trans fats. Hold on. I was told when I was when I was a kid in the 80s and 90s, my mom used to make this pot roast every Sunday, and then she put this huge tub of country crock on the table because this margarine substance was supposed to be better than butter at protecting against blood clots and heart disease. And every single medical journal, including the American Medical Association, the JAMA, the Journal for the American Medical Association, the New England Journal of Medicine, they had ads inside the journals, inside their printed books, that margarine actually prevented heart disease better than butter. Well, I'd like to ask you, Christina, is that true?
Not true.
All right. Well, they figured out that is not true. In fact, they figured out that the substance that makes up margarine is actually one molecule away from plastic, one carbon molecule, by the way, added to it. And then it turns into a solid, which is contributing to increased heart disease, blood clots. And then they found out through research that butter all along was so much better for you. So I lather up my pot roasts, potatoes, carrots, all that good stuff with real butter, not like the country crock or parquet crap we were sold the idea early on. And medical doctors were all over that one for like 20 years talking about how great margarine was. And then remember Fabio? Remember that guy, Christina? Fabio? Remember him? Beautiful hair flying in the wind. He couldn't believe it wasn't butter that he was eating. Remember that? Eat butter. Your body knows how to do better with butter, not these alternative margarine crap. Avoid it. It's going to lead to heart disease if you eat that stuff. It's already been proven. But just like the COVID-19 vaccines right now, you were told for a long time that was going to be the only thing to help produce and prevent and reduce risk of heart attacks and strokes, only to find out later that was not true. Well, a year and a half into this onslaught, actually just 12 months into this onslaught of vaccinating the entire world, we're seeing athletes around the world dying, teenagers dying, myocarditis all over the place, blood clots, increases of cancers. Thomas Renz reported to Senator Ron Johnson last week there's over 1,000-fold increase in all diseases for the military since the shots have been pumped out. 200 times more increase in miscarriages since the vaccines have started. All right, you're all being lied to, and eventually it'll come out. It'll all be true. And then we'll all look like heroes. Right now, we're being told to not trust us, and we're spreading disinformation. Actually, consider us terrorists. Per something Zev Zelenko sent me earlier tonight. Okay, and we'll share that with the audiences later, maybe tomorrow. All right, how to avoid heart disease for real. Don't eat country crock. That's a load of crock. And then eat the meat, fat, and organ meats of grass-fed animals. Yes, you read it. Organ meats. Yes. And if you're not going to eat those, you better start taking supplements that actually have organ meats in them to help protect against autoimmune diseases against those organs. That's why I actually love standard processed products. Eat plenty of wild-caught seafood. I love seafood. I'm from New Orleans, so we love it. And I agree. Wild-caught's always better. Number 5 or 6 here. Do not consume protein powders, lean meat, egg whites without the yolks, or skim milk. Just eat the whole eggs. High-protein diets lacking the nutrients supplied by animal fats can deplete vitamin A, leading to heart disease. Eat the grass-fed animals. All right, now this next one I've never done. I probably won't do, but for those of you who like liver, eat liver at least once a week. I am not going to do that. I hate liver. I don't want to eat it. But supposedly it's very healthy for you. I'll let y'all decide. All right, you can do cod liver oil, which I love, which is a great source for vitamin D and omega fats and vitamin K. You'll see that there. Maintain a healthy weight. Engage in moderate exercise outdoors, and don't smoke. Avoid exposure to environmental toxins like COVID-19 vaccines. Those are environmental toxins. All right. Before I get into some amazing stuff here, we'll touch on some stuff here. I got to. All right. I have to go back to some of the listed side effects of these drugs. Okay, so I have a printout here that my producer did not know I was bringing, but I worked on this all afternoon. I actually am going to read off what the top 5 most prescribed cholesterol drugs are, because I know the majority of people, those 35 million Americans that are taking these every day, they're on one of these. So Lipitor is number 1, like I mentioned, the most common since 1997, most sold prescribed drug in the country. Fluvastatin sodium is another one. Pitavastatin, which is called Livalo. And then Pravachol, betterwise known as Pravastatin. Consumer Digest says, really, Consumer Reports listed this drug as a best buy for statin drugs. That's what it says. And then Zocor. You've heard of Zocor, I'm sure. Simvastatin is its name. Remember, they all have statin in their generic name. It says this drug is cheaper than the other statins. Great. So if you want cheaper, better. I'm going to only talk about two. Lipitor and another one, which is pravastatin. We're going to talk about these two out of the most common 5. Reason why we're going to talk about Lipitor, the majority of you or your loved ones that are taking it are on it. So I went to drugsrx.com or drugs.com, one of the two. And what I did is I wanted to take, for consumers and for healthcare professionals, they have a tab there if you're looking at the drug, that you can print out and look at what are the published worst and most common side effects of those drugs. Well, I took them both, the consumer version and the healthcare practitioners, the doctors who are prescribing these drugs. And I want to bring your attention to Lipitor, otherwise known as atorvastatin. Okay. Common side effects of Lipitor include hemorrhagic stroke. Now, hold on. Now, wait. I just have to tell you something. This actually is common side effects. Very first one listed underneath the healthcare providers section. And you don't have to be a healthcare provider. Just go click it. It opens for everybody who wants to read it. Lipitor side effects. Common side effects of Lipitor include hemorrhagic stroke. How many of you were told that your statin drug you needed to be on was going to help reduce your risk of a stroke? Okay. It listed as a common side effect. Arthralgia. Do you know what that is? Arthra means joint. Algia means pain. So how many people are on cholesterol drugs and all of a sudden develop joint pain that now you're diagnosed with arthritis for, and now you're put on prednisone and other drugs for the rest of your life when it's actually a published common side effect of Lipitor? Diarrhea and nasopharyngitis. All right, so diarrhea. There's a lot of people diagnosed with IBS-D, irritable bowel syndrome, primarily diarrhea. If you started diarrhea after you started a cholesterol drug, stop the statin drug. Lipitor's known to do it. If you have reoccurring common cold-like symptoms or flu-like symptoms, that's nasopharyngitis. That is a common side effect of Lipitor. All right, side effects requiring immediate medical attention. They say, so pay attention. If you're on Lipitor, you have any of these side effects, you need immediate medical attention. It says, it's funny, it says cough. Isn't that weird? If you start coughing, that's a problem that needs immediate medical attention. Difficulty swallowing, dizziness, fast heartbeat, fever, hives, skin rash, muscle cramps, puffiness, swelling around the eyelids, water retention, tightness in the chest. Oh, that sounds like a heart attack. Tightness in the chest is a sign or symptom of a heart attack, by the way. Unusual tiredness or weakness. Side effects that don't require immediate medical attention when you're on Lipitor: headaches, hoarseness, losing your voice, lower back or side pain. You don't need immediate medical attention. You can call us next week. Pain or tenderness around the eyes and cheekbones, painful or difficult urination, because everybody wants that as a side effect. That's not a side effect of normal cholesterol levels, by the way. And then a stuffy or runny nose. And then, it mentions here also for healthcare professionals. I don't know what that was you just put up on the screen, Mark. Do you want to elaborate on that?
I don't know what you're talking about.
Oh, okay. All right. Okay, so for healthcare professionals, general, the most frequently reported side effects were nasopharyngitis, and according to medicalnewstoday.com, nasopharyngitis is another name for the common cold. It's a mild infection of the nose and throat that can produce symptoms such as a runny nose, sneezing, and coughing. Well, it said over here, the most common side effect that needs requiring immediate medical attention was a cough, and that's a known side effect of Lipitor. All right. It develops supposedly, most often, Medical News Today says, nasopharyngitis actually occurs from viral infections. That's interesting. How come when you start taking the statin drug, you start having viral symptoms? Currently, however, it says here on Medical News Today, there are no antiviral medications that can fight these viruses that cause the symptom. And antibiotics will not treat, I quote, antibiotics will not treat a viral infection. Isn't that amazing? Do you know that every COVID protocol actually enlists an antibiotic for a viral infection, supposedly? Every single one of them. It's insane. So it says here, so doctors prescribe them only if a person has a complication due to a bacterial infection. Talking about antibiotics. I just want to bring it to your attention. Anybody who puts you or your loved one on an antibiotic when you have a viral infection, you should bring their attention to Medical News Today and the CDC because they say that's unwarranted. All right. Second most common side effect, nasopharyngitis was number one. Common cold when you start Lipitor. Number two, arthralgia, joint pain. What does that actually define as on John Hopkins? Nope, Mayo Clinic. Neuralgic pain in a joint or joint is arthralgia. Pain in a joint. So if you have arthritis, it says that means that's a known published side effect, which we mentioned. Then it mentions diarrhea, pain in extremities, arms and leg pain, and urinary tract infections are the most common that need medical attention. All right. Now it breaks it down for each organ in the body and what are the most common side effects of Lipitor. So if you're on Lipitor, have a loved one with Lipitor, and they complain of any of these things, it is published that 10% of every Lipitor person that takes this drug will have these symptoms or side effects. Ready? Here we go. And they list them as common or very common. So with Lipitor, GI problems, diarrhea, and dyspepsia are the most common. Dyspepsia, dyspepsia, is actually indigestion. Do you know that over-the-counter drugs in America, there's nothing that is sold more than indigestion drugs like Tums, one that starts with a P. I don't even remember what it's called. Anyway, there's a bunch of antacids that are sold. The most common side effects for the GI tract with Lipitor, statin drugs, is indigestion. That means if you will just stop the drug, your indigestion will disappear. It's actually being caused by the drug. And this is over 10% of the people that start this drug. All right, you just need to know that. Oh, and Mayo Clinic says that dyspepsia, this is the symptom, just so you know. This is a symptom of Lipitor. It is a discomfort in your upper abdomen. Indigestion describes certain symptoms such as abdominal pain, a feeling of fullness soon after you start eating, rather than a specific disease. Indigestion can also be a symptom of various digestive diseases. That's what the Mayo Clinic said. Actually, it's a side effect of Lipitor, just so you know. Stop Lipitor if you have any GI symptoms. And then for your liver, let's go to musculoskeletal. Very common. 12% of everybody ever given Lipitor complains of arthritis occurring as a result. All right. And then after the actual research studies for Lipitor, they call it post-marketing reports. There is a very common reported after the research study stops, but you're staying on Lipitor, where the people who were in those trials reported tendon ruptures, meaning tendons in their bodies were just tearing in half. Isn't that great? Sounds awesome. That's a side effect published of Lipitor. Nervous system, headache over 10%. After the research studies ended, people continued to complain most commonly of cognitive impairment, memory loss, forgetfulness, and memory impairment. I want to speak to this. I had a patient that came in. He was a very wealthy patient. He came in, he'd been to the Mayo Clinic 5 times in 1 year for a condition they called aphasia, which means he could think of what to say in response to what he heard to somebody say to him, but it took a delayed time period for his mouth to speak his thoughts. In fact, he could write it faster on one of those Magnadoodles or on an iPad faster than his mouth would repeat it after his brain articulated it. This guy was brilliant, massively successful, 5 trips to the Mayo Clinic in 1 year. Every test you can think of, they couldn't figure out why it was he couldn't speak as fast as he thought. So literally, when you asked him a question, like I'd say, well, where are you from? What do you do? It was a minute later before his mouth would say the answer. So he would just write it on an iPad so I could see it. I went home that night and I went into his drugs that he had been prescribed. This was going on for 2 years. So I just asked him, any of these drugs did you start 2 years ago before I actually start recommending you anything? There were 2 cholesterol drugs he was put on 2.5 years earlier. When I went into the studies, I actually looked up studies. I wanted to know the drugs he was on, is there a side effect of aphasia? Aphasia, the inability to produce words. Sure enough, his age group alone had the highest reported occurrence of aphasia as a side effect to the cholesterol drugs. So he comes in the next day and I printed out the reports. I gave them to him and I said, just so you know, the Mayo Clinic missed it. They didn't even review the side effects of the drugs you'd been on for 2.5 years. And I said, did you even have high cholesterol 2.5 years ago? Who put you on those drugs? And he told me it was his primary care doctor in Texas. And I said, did you have high cholesterol? This is not a joke. He wrote on his iPad. And he showed me, and it said, the doctor prescribed this to me for prevention. He didn't even have high cholesterol. So all I did was tell him to stop the actual cholesterol drugs. And 2 weeks later, after 2 years of avoiding boardrooms because he was embarrassed by his ability to communicate with people that worked for him, 2 weeks went by and he was able to start articulating at the same speed at which he thought. That was a side effect of the cholesterol drugs on him neurologically. All right, just had to share that story. You didn't know that was coming up today, did you, Christina? Nope, you didn't know. All right, let's talk about psychiatric insomnia. Known listed side effect of Lipitor, over 10% of all people that start on the drug. Confusion and depression are on the longer ends. If you stay on these long enough, you'll start developing confusion and depression. Why? Because you're destroying your ability to produce cholesterol that's needed to make hormones that help you think, remember, and feel happy. Okay? And produce bowel movements, by the way. Serotonin is required for that. Urinary tract infections under the heart category for Lipitor. It is common. This is what it states, common. They have very common, mild, and rare. Under common for Lipitor, upwards of 10% reported. Cardiovascular death. I know you can't see this, but it's highlighted right there. Watch this. I'm going to point. So somebody's at home on a really big screen, they can see it. Common. 10% cardiovascular death after starting Lipitor. Then we get into, also, under other category for Lipitor side effects, common between 1% and 10% report non-heart related deaths. So you died for some other reason. All right. Let's go on to Pravastatin, the one that Consumer Reports says is the best deal for Americans as far as a statin drug. All right. Most common side effects that need immediate medical attention once you start Pravastatin. Number one, difficulty with moving. It's very interesting that these have very different side effects. Difficulty moving, muscle or bone pain, muscle stiffness, pain in the joints, localized pain. Side effects, here we go, general. The most frequently reported side effects were musculoskeletal pain, nausea and vomiting, upper respiratory tract infections. Remember, LDLs keep us from actually getting viral infections. Diarrhea and headache. As far as musculoskeletal, in the Lipitor group, it was 12% of everybody who started Lipitor developed musculoskeletal pain. Not with Pravastatin. It's actually published 25% of everyone that goes on that drug complains of musculoskeletal pain, and they list it as a very common, most common side effect. If you're on that drug, stop it, especially if you're in pain anywhere in your body. It's ridiculous. Post-marketing reports of this drug, so after the research studies ended, they found that with Pravastatin, autoimmune diseases were reported more commonly than any other drug, including lupus, systemic lupus erythematosus, polymyalgia, multiple organs in the body with rheumatica, and then an increase in anti-nucleic antibodies, which is what you look for in the blood, that tells you your body's attacking your own tissues. Amazing. Upwards of 11% expressed vomiting as a side effect. Very common. Another one is chest pain. I love that one. And then influenza and fatigue, chills and asthenia. I just want you to know, asthenia, A-S-T-H-E-N-I-A, it actually means physical weakness or lack of energy. How many people get very tired and weak? Go to any nursing home, independent living center, these elderly people that are on drugs, watch how tired they are. Most of them are on cholesterol drugs, by the way. Post-market reports with Pravastatin, post-marketing reports, fatal hepatic failure, hepatitis, non-fatal hepatic failure, cirrhosis of the liver is reported. Facial paresis, that's facial paralysis of the facial nerve becomes paralyzed. You ever heard of Bell's palsy? That is a published side effect of Pravastatin. Upper respiratory tract infections are reported in 22% of everybody that starts that statin drug. So if you have a loved one who's chronically getting upper respiratory infections, find out if they're on that statin drug and get them off, and then it'll all go away. Vasculitis, cardiovascular-wise, is a side effect, and per Johns Hopkins, it is a systemic illness where the patient overall will feel sick. They often have fevers, weight loss, fatigue, a rapid pulse, and diffuse aches and pains that are difficult to pinpoint. It's called vasculitis, inflammation of all your veins and arteries in your body. Blurred vision and double vision are a side effect of that drug. Sleep disturbances and depression. Thyroid dysfunction, which we talked about 2 weeks ago. Also, this one's one of my favorite, only because I remember it from board exams in chiropractic school, which there's 4 of you have to take. Gynecomastia is a side effect of pravastatin. Do you know what gynecomastia is, Christina? No? Gynecomastia is where males develop breasts. That's the impact of the hormone disruption created by this statin drug. That is a published side effect of pravastatin. And then, as far as cancers go, it is a published side effect of what is called hepatomas. Hepatoma is a unusually large malignant tumor in the liver. So these are all published side effects. It causes cancers, leads to heart attacks and death. Don't do those drugs. All right, so we have about 18 minutes left for this show. Have you learned anything yet, Christina?
Yes, great show.
You think our audience has learned anything yet?
Absolutely.
Okay, great. Now, there are actually some things that can actually improve cholesterol overall, believe it or not. If you actually believe you have high cholesterol and you want to improve that, there's actually 3 nutrients that are specifically proven to actually, in research studies, help reduce cholesterol numbers, LDL particularly, to bring that down just slightly, like 5 to 6%, which improves overall your cholesterol outlook if you're concerned. Those 3 are vitamin C, vitamin D, and magnesium, all of which we have at the drardisnicotine.com. We'll show you a little slide here at the end of this with a picture of them. But vitamin C, vitamin D, and magnesium. So I'm going to throw up some of the, not this one. Let's go to the other research studies. No, we're going to do that one last. Let's go to the last. Mark, we're going to go to the slides that were in the email, if you remember. Yep, here we go. Vitamin D levels. Rock and roll. All right, so treating low vitamin D levels, he's just going to roll through these. Vitamin D is proven to actually, in these studies, reduce cholesterol. Keep going. We just want you to see them on the screen. Effective vitamin D supplementation on serum lipid profiles. There you go. Keep going. This is vitamin C. It's actually 500 milligrams a day is what they found and concluded helps reduce cholesterol levels. All right, keep going. In the journals. Yeah, keep going. This is great. We're just showing these. Vitamin D, great. This is for COVID, by the way. Keep going. Love it. Vitamin D deficient in COVID-19. This is phenomenal. This is out of India. All right, keep going. Great, keep going. Conclusion. Yep, we're doing great. Magnesium can lower, go back. Magnesium can lower cholesterol. Studies show this is actually in 2016. And you can see it's written by a medical doctor and a PhD. Magnesium intake is important for reducing heart attacks and reducing cholesterol levels. Phenomenal. We knew that back in 2016. And we have magnesium complex at our site. All right, next study. Does dietary magnesium modulate blood lipids? Yes, it does. We've got that there. Next, if there's another one. Yeah, there we go. Does it? Absolutely. The changes in the blood lipids were consistent with an increased intake of magnesium. Amazing. All right, keep going. I wonder how many people listening to this who have loved ones were told that instead of statin drugs, you could try vitamin C, vitamin D, and magnesium, and there's plenty of studies supporting that. Well, we have them there. All right, now we're going to put up this, we're going to talk about cancer here. As you can see up on the screen, there was a publication. This is back in April of 2008. The question posed is the title, do statins prevent cholesterol drugs? Do they prevent or promote cancer? Next slide. It actually says here, this is a compilation of studies. So I'm going to read these to you, all those listening while you're driving around, or if you're reading the screen, follow along the blue areas. A 3.2-year perspective study on pravastatin for cardiovascular disease prevention in the elderly at high risk for cardiovascular disease. Cancer incidence was significantly increased in subjects randomized to pravastatin. Next slide. Analysis of the TNT study. Elderly subjects randomized to high-dose atorvastatin, which is Lipitor, at 80 milligrams a day versus low-dose atorvastatin of 10 milligrams a day, demonstrated a trend toward increased death, largely from an increase in cancer mortality. Lipitor, the higher the dose, the increase of death from cancer. Next. All right, so I'm going to read this out. Indeed, analysis of large randomized statin trials, cholesterol drugs, demonstrate a highly significant inverse association between achieved low-density lipoprotein, or LDLs, and increase in cancer. That's an inverse relationship. Because cholesterol goes down, LDL, they see cancer going up. Close inspection of statin trials reveal the specific populations at risk for the development of incident cancer with statin drugs. These include the elderly and people with a history of breast or prostate cancer. Furthermore, statin-treated individuals undergoing immunotherapy for cancer may be even at a higher risk for worsening cancers. Next slide. Likewise, post-hoc analysis of the lipid study, a 6-year prospective trial of pravastatin, which Consumer Report says is the best buy, in individuals with cardiovascular disease, revealed a significant increase in cancer incidence in the elderly subjects aged 65 to 75 years, randomized to pravastatin, those getting pravastatin. Next slide. It is highly plausible that the elderly are particularly sensitive to a statin-induced increase in TREGs, which is a marker for cancer, further impairing their immune response to cancer. Next slide. There is an alarming increase in breast cancer incidence, some of which were reoccurrences, was seen in women randomized to pravastatin in the CARE trial. Thereafter, cancer was an exclusion criterion in randomized statin trials. What that means is they were doing trials on people and allowing women who had breast cancer in the past to participate in the pravastatin trial, only to find out that those who had cancer before were getting more and more cancer. So they excluded anybody who had breast cancer before in the future trials. They didn't want to see this occur anymore, so they didn't let them participate. But thereafter, cancer was an exclusion criterion in the study. In clinical practice, however, it is not infrequent, it reads, to find an association between reoccurrence of breast cancer and concurrent or current statin therapy. If you are a loved one or you have a history of cancer, I don't know if you have gotten anything from me reviewing these with you. There is a connection to cancer and statin drugs, particularly with the elderly, which I promise you the majority of elderly are the ones on these drugs because they're trying to prevent them from having heart disease. All right, now let's go to the final, I want to go to the final slides we had there. Por favor, Mark. This is important to the vitamin D discussion. This just was published last week. This was in Israel. They looked at in Israel, I think it was 1,100 patients, and they wanted to know what was their vitamin D levels before they got COVID, after they got COVID, and based on their vitamin D levels, what was the severity of their COVID-19 disease? Next slide. The results were 1,176 patients were admitted in Israel. 253 had records of 25. The measurement was 25 for vitamin D in their blood. A lower vitamin D status was more common in patients with the severe or critical disease of COVID-19 than in individuals with mild or moderate disease. I'm going to show you one chart from this actual published study from last week. Next slide. This is directly out of that study. So you can see the levels at the bottom of the chart from 0 up to 180. That's how much vitamin D per nanogram of milliliter of blood. Without even having to look, you can see the lower the vitamin D levels is, just look at 20 and below, 20 to 0. If it's at 20 or below, go from 20 and go straight up with your eyes. You'll see the clump of moderate, and then above there, you're going to see the severe cases and then the critical cases. Almost all of the moderate, actually almost 90% of all the severe, and 100% of all the critical COVID-19 cases had lower than that 20 measurement for vitamin D in the blood. So there is a direct correlation, and you look down at mild. For those who had vitamin D levels around 40, you'll see that's the majority of that group there who had the mild symptoms. Vitamin D is directly correlated to your ability to fight infections, provide immunity, And I just want to bring this to your attention that it is very vital now. All of the studies here were using 5,000 IUs of vitamin D, which is exactly what the vitamin D is that we have at the Dr. Ardis show. So if we show you this last slide from our presentation, these are the three. You've got magnesium, you have vitamin D3, and our immune C complex. We're just showing you these here because I actually launched these about 4 months ago because I knew the power of specific vitamins and minerals and their impact on your health. It just so happens that as we talk on various health topics, you're going to see they relate very often to those disease processes. For example, we just showed research studies that magnesium helps to reduce overall LDL cholesterol. We showed you vitamin D does the same thing. Vitamin C also. I just wanted to throw up that slide because it's so relevant even to this week. Israel's published study, vitamin D levels are critical at helping to mitigate and keep you at moderate to mild symptomatology for COVID. The lower the vitamin D levels, the proven more critical their cases were for COVID. So I just wanted to bring that to your attention. All right. Was that a good cover?
That was great.
Of cholesterol? Did we destroy that narrative? Okay, good. All right. So Christina, do we have any questions? Do you have any thoughts?
We do have a few questions. Let's see. A generally healthy 55-year-old, cholesterol is 220 to the 230 range. In your opinion, is that too high? And is there something they should do to address it, change their diet, add in healthy fats? What do you think?
Great question. The levels at 220 to 230, please don't ever worry about that. I would just let that go. Do not be concerned about that, please. And if you're on a statin drug, please come off of it. If you're going to do anything else, I would suggest and recommend you need to get on magnesium. Number one, it's the number one mineral deficiency among all humans. Please be taking at least a minimum of 500 milligrams every day. And that will help lower LDL cholesterol if you're worried at all, but only like 5 or 6%. You probably don't really have a concern there. But by far, the three I just recommended, magnesium, D3, and immune C for sure, or vitamin C. I absolutely do want to say, though, and reiterate, please, everyone that walked in and had any concerns of cholesterol, go, can you let that go and just ignore that? Because remember, 85 to 90% of all of your cholesterol levels come from your genetics. So anyway, great question.
All right. Do you know anything about red rice yeast?
Red yeast rice actually is what it is.
Okay.
That's okay if they got it backwards. Red yeast rice, yes. I actually use red yeast rice a lot in practice and recommended it to patients. There's an acid inside of red yeast rice that you have to avoid, and it starts with an M. It's like malconic K2 or something like that. Anyway, look for that on there. If it's not on there, good, use it. If it's in there, you should avoid it. But I would actually absolutely suggest any organic versions, whole food versions of, and I don't mean whole food the store, I mean whole food supplements of red yeast rice. Red yeast rice, you can just follow the recommendation on the bottle. It's been used in Asia for years to help lower LDL cholesterol levels naturally. There is also an incredible extract called artichoke extract. If I ever did anything while I was in practice and they had real major concerns, then it was artichoke extract along with red yeast rice that I would recommend to them. And artichoke extract you can get from the North Texas Healing Center, which is one of the sponsors here, the NorthTexasHealingCenter.com. Typically, alternative healthcare practitioners or medical practitioners have an account with a company called Marca-Pharm out of Germany and carry this artichoke extract. It is phenomenal at improving liver function and the breakdown of fats in the body.
Great. Do statin drugs deplete CoQ10?
CoQ10 is made from your liver. The answer would be yes. You got to the cholesterol is needed to create CoQ10 and so many other things. So yes, if you're taking ubiquinol and CoQ10, which is CoQ10, if you're taking that and you're also on cholesterol drugs, you're really defeating the purpose.
Okay.
Also, I want to speak about Cheerios. One time I was in a lecture in Florida with a doc, and this doctor at the very end of this like 3-day seminar goes, anybody got any questions? A 3-day health seminar. And I, being smart aleck, raised my hand. I said, yes, I have a question. Are Cheerios good for the heart? Because, you know, they promote Cheerios, the cereal, for good heart health and helps lower cholesterol, supposedly. And everyone's busted up laughing, all the docs, except for the doc at the podium. He's standing there, and everybody's like trying to pack up their bags as they're laughing because they know it's just a joke. But this guy goes, does anybody really want the answer? And I was like, yes, actually, I do want the answer. And he goes, yes, Cheerios are good for the heart because they lower cholesterol. And he goes, do you want to know why it lowers cholesterol? And I said, why? And he goes, because there's zero nutritional value to Cheerios. If you eat Cheerios, you might as well just eat the box or bark off of a tree. There is zero nutritional value there. There's zero fat in it, which is why it's going to reduce cholesterol production. It has nothing to do with benefiting the heart. And he goes, any questions about that, Dr. Ardis? And I was like, oh, no, I'm good. Thank you. I wasn't going to recommend it anyway. You notice Cheerios were not one of my supplements here, just so you know. I don't have a Cheerios supplement. All right, there's a question on the vocal chat.
Hey, Dr. Ardis. The question on the vocal chat is, what should I say to my doctor who's trying to put fear in me about hardening of the arteries and these other like scare tactics? What should be my response to that?
I love that question. Actually, the one thing that's bothered me the most, you hear it now a lot, where a person here in the United States or somewhere else will tell their doctors they don't want the vaccines, and the doctor will threaten them like this. You don't get the vaccine, you can't be a patient here. We're going to fire you from the clinic. Do you know how many times I heard that in 20 years of practice from patients with their general practitioners or their cardiologists? They would go to them and go, but I don't want to take that cholesterol drug. And they'd go, if you don't take that drug, you can't be a patient here. Well, I just gave you all the information that statin drugs are linked to autoimmune diseases, cancers of all kind, and heart failure. And if this doctor is looking at you and saying, you need to take this or X is going to happen, you're either not allowed to be here or you're going to die of a heart attack. I just showed you the studies. Please, please, please. You are the only one that can make decisions on behalf of your own body and your own health. If you have a doctor who's going to use fear and authority to scare you, you should view them the way I view Anthony Fauci and any other authority telling you need these vaccines to protect you from COVID. I mean, that's just how I am. I would want a doctor who would be open to hearing your concerns and allow you to profess those concerns, maybe bring some documentation to them and see if they can refute those, help calm those down for you, or side with you and have respect for you enough that you have the right and the freedom to make choices of what goes into your body. It is your life you're living, not his. So don't let somebody else threaten you with what you're going to do with your own life. Great questions. All right. Any other questions?
What's up?
Any other thoughts?
You going to talk about the FDA document?
Yeah, we got 1.5 minutes here. I don't really know how to get it to you right now so you see it, but
Mark, you have it. There we go.
Here we go. It's on the screen right now. You can type in any search engine, regulations.gov. Type in a search engine, regulations.gov, and type in public docket, and this will come up. You'll see on the screen the blue button comment. Click comment. You then write a comment in that first little section there. Now, I would like you, Mark, to actually click on what is your comment about? Select a category. Can you click that for me? Inside of this part, I just want people to pick individual consumer. I don't want people getting stuck in this. This is like a 5-minute process. Write a comment here, provide a comment and a link. 30 seconds here. February 15th, the FDA is meeting to discuss giving these mRNA vaccines to all 6-month-old children to 5-year-old children, which is there's like 18 million of them. That's what they're doing on February 15th. You should voice and write in a comment here. It goes to the actual group of people between now and February 10th. They receive all these comments and are supposed to review them to help either change their mind or encourage them to do it. Please submit a comment to the FDA. Within 24 hours, we've already gotten 9,600 comments. We need like 500,000. I'm Dr. Ardis. Please support us at thedrardisshow.com, and we'll be back next Tuesday to destroy another narrative. Have a great week.
Disclaimer. Please note, the following presentation is solely for informational purposes and should not be seen as a replacement for advice provided by your physician. It is important not to rely on the information from this presentation for diagnosis, treatment, medication prescription, or any other form of medical care. Always consult with your physician or healthcare professionals before taking any medication, nutritional supplement, herbal remedy, homeopathic treatment, or pursuing any health-related procedure. If you have a medical condition or believe you might have one, promptly contact your healthcare provider. Do not disregard professional medical advice or delay seeking it based on this presentation's information as the products or services purchased from it do not establish a doctor-patient relationship between you and any affiliated physicians. Statements about dietary supplements have not been evaluated by the Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent any disease.